My name's Alexi, and Alan is my dad.
So a stroke basically is, at its very basic level, is brain damage caused by a loss of blood supply. So for some reason, the blood isn't getting to a part of the brain that needs blood, right? Because blood carries oxygen, and we need oxygen for our cells to survive. So without this oxygen, this area of the brain is damaged and starts to decompose, basically. This can happen as a result of either a blockage of blood flow, so an artery can be blocked by, say, a blood clot, for instance, or narrowing of the artery from a lot of cholesterol deposits over time, for instance. And so a blockage can occur in an artery, and sometimes it's a major artery, and it cuts off blood supply to a good portion of the brain. Other times it can be a very small artery, so it's a very small stroke.
And you know, Alan, we always start with working on these different areas, right? Because we know that with that left brain, that's where you had your injury, it can affect all these areas: speaking, reading, writing, and understanding speech. So let's do some of that today, okay?
And another type of stroke is a bleeding type of stroke. We call it a hemorrhagic stroke. That's when the blood vessel actually bursts or ruptures, and so there's bleeding that happens in the brain, and that bleeding stops the flow of blood to where it needs to go. Okay, so the blood still isn't getting to the brain and not supplying oxygen to the brain like it should. And that's the bleeding type of stroke that you may hear about too. So he did not have a bleeding type of stroke. Alan had occlusive type of stroke, a blockage type of stroke.
You know, oftentimes with people that have strokes, such as Alan did, what we do is we assess to make sure that this is a patient that is able to withstand up to 3 hours of therapy per day, which would include physical therapy, occupational therapy, speech therapy. A lot of times, people that have strokes are impacted in terms of their mobility, their ability to express themselves, to understand what information is being given to them, and how to put that into action. And so a big part of what I do is work with patients and families in adjusting to the deficits that a stroke may bring to them, but at the same time maintaining their level of independence that they're hoping to achieve.
My dean is Alan.
With Alan, the biggest part of him that was impacted by the stroke is his speech and his communication. However, he also had some impairments with mobility and things like that, but really it was his speech and communication that we focused on the most.
Feel where your tongue's going with that sound? La, la, la. Yeah, yeah.
From the first day he came in, my first job was to do an assessment. And what my assessments look like is trying to figure out, you know, what was his prior living situation? What did his social supports look like? You know, what was his prior level of functioning? And in Alan's case, when I first met him, he was nonverbal. He wasn't able to really speak at all. It wasn't very clear initially whether he was really understanding what I was saying to him. And so from there, I then shifted focus and talking to family, which is where Alexi comes in, and that's when her and I started talking a lot more.
It's awesome watching him just fly through things, you know, certain things that he said, or not he said, but other people said that, you know, it would take months and years to accomplish. He's done it in 3 weeks. So my dad and I have always been pretty close. It was weird because I hadn't heard from him. Something triggered in my head. I'm like, I haven't heard from him. So my mom was at my house helping me, and he lived on our property. And I said, hey, when you go home, can you go check on Dad? I haven't heard from him since Thursday. And that's pretty weird because he'll send me something every single day. And so time goes by, and she calls me, and she was like, hey, I'm here with him, but he's just looking at me. He's not saying anything. And my heart just instantly dropped because I had this intuition that I knew something was wrong, but I didn't know what. And so I sped over there, and I go in he lives in a trailer, and I go in, and it was weird because it was raining that day. Had been sunny all week up to that, and then it was raining. And the trailer door was open and his fan was on. So I go in there, and his right side of his body is dangling off of his bed. And he had the blanket over his head. And I said, Dad. And then he took the blanket off and looked at me. He looked through me. I didn't know if he was going to make it. And, you know, when he did get to the hospital, it was great. I was happy that he did get the care he did. But the prognosis that the original doctor gave him was not good. He essentially was saying that he doesn't have any confidence that he's going to be able to swallow again, be able to move his right side of his body, to understand, to do anything. And so he said, you know, what kind of quality of life is that? And, you know, with everything, I was like, yeah, what kind of quality of life is that? And then he said, you know, we got to, if there's no big progress in the next 2 days, we got to start thinking about hospice.
So his ability to actually, you know, use his right arm and hand and right leg is, you know, is gone. And his ability to understand speech or actually say something is gone.
Okay.
And it also really affects someone's ability to swallow. I'm very concerned he won't be able to swallow again. And then, so we have to wait, I'd say at least 2 more days to see if he improves. And if he doesn't, then, you know, we're going to have to make a decision in either putting in a peg tube or think about hospice.
Has somebody ever got a feeding tube and then learned how to swallow after that?
That is possible. I think in your dad's case, I think if he needs I think if he does not improve his swallowing ability, I don't think he'll ever come back.
There were a lot of factors going against him because of this, because he couldn't move this right side of his body, because he couldn't speak, because he couldn't swallow either. There were a lot of health issues that were impacted, and his blood pressure was out of control. When your body isn't able to move naturally, a lot of other negative cascade of events can happen. You can develop blood clots just because you're not moving. You can develop skin breakdown. You can develop pneumonia because you can't swallow. So there's all these risk factors that add up as a result of the complications of having had a stroke. But he did have his youth in his favor, and he sure seemed to have a lot of determination because he really, really, I think, far exceeded the expectations of the doctors that initially saw him in the hospital.
He was so excited to go to therapy. He's definitely been one of the most motivated patients that I've seen here and have met in terms of always having a smile on his face.
He has an amazing attitude. He does anything we tell him to do. He works so hard. You know, he could have chosen just to give up. It's so frustrating. If you can imagine having all these thoughts in your head and not being able to get them out, right? Not even be able to ask to be able to go to the bathroom or to have help with something or to say you're hungry or thirsty or, you know, you want to get up and move around. He couldn't do any of that. And just been an inspiration because he's not giving up. And that's what rehab is all about, is just one day at a time, one step at a time, we make progress. We make progress, we make progress. And he just was always ready to go every single day.
Just seeing every day, because with COVID, I wasn't allowed to go into the hospital, so I'd FaceTime every day, like clockwork. And just seeing the micro improvements, like his smile and the right side of his face not drooping as much, I was like, that's huge, you know? And I know a lot of doctors they try to prepare you for worst case scenario, but these little things gave me so much hope. And every day there was some little progress. And one day I was FaceTiming him and I said, hi, Dad. And then he said, hi. And I was like, what? You can talk? You know? So it was just all these little improvements that, you know, regardless of what we thought it was going to turn into, it turned into something so much better. And when he got to rehab, you just realized how much will he actually had to live. That's hard, huh? I started posting his progress on TikTok. And I had a couple videos in the past go viral on TikTok, and then I just kept posting his, and I did not realize how many people were going through the same thing or had family members that went through the same thing.
Good job. High five.
There's been so many comments on there of people just encouraging him and pouring out so much love to this guy they've never met who's across the globe. And so I started reading those comments to him, and you could just tell he had so much joy. He would laugh, he would smile, he would say yes, or he would I would do video reactions to some of them because they're funny. And I think his laugh and his will to live has brought a lot of people joy as well. And I can't tell you how many messages I've got through TikTok or Instagram or whatever that people are saying, hey, my dad had a stroke. Hey, my grandpa had a stroke. My grandma had a stroke. This family member of mine had a stroke and they've recovered. So keep the faith. Or, my family member had a stroke and didn't make it. Or my family member had a stroke and is, just had one. So what should I do? How do I stay positive? And, I think by sharing my dad's story online, it's really helping, number one, bring awareness to stroke, which is a huge silent killer. But number two is helping people remain positive and showing people that there is a light at the end of the tunnel if you have the will.
I recover.
Yes, you will. Amen. Say amen.
Amen.
So what message of hope do you have to people who have had a stroke and they're in the same shoes you are, where they have the aphasia and they can't talk,
Yes.
they can't communicate the way they
Yes.
want to?
Yes.
What message of hope do you have for them?
Keep on keeping on, because tomorrow you never know what's going to happen.
Oh my god, that was so good.